Harrison Luttrell. I'm a PGY3 internal medicine and pediatrics resident.
I'm Sasha. I'm from Nebraska.
I grew up in Fort Wayne, Indiana.
My name's Finale Patel. I'm a fourth-year Med-Peds resident.
I was born in Guatemala City, Guatemala.
IU had the best combination of everything I wanted.
I was interested in IU because it's a larger Med-Peds program.
Where I really wanted a place where I could get a diversity of experiences from the patient population to the kind of hospitals that I was working at, and then the disease processes as well.
We just approach medicine, I guess, in a different way because we see children and we see adults. And sometimes those skills will translate very well into the other side.
When you're looking for a job, after residency, you have that experience of working in the vast majority of settings that you could possibly practice in, which was something that I didn't really think about as like a medical student initially.
Somebody who is interested in global health, who's interested in working with diverse patient populations, who wanted to have great experience in medicine, great experience in pediatrics.
So you have lots of opportunities to work with all types of groups that are representative of the society in which we live.
IU really encapsulates all of that.
I loved that Indianapolis has that big city feel, big city opportunities with the convenience of a smaller town. You have a great program with great clinical experiences, but it's also equally important that you'll be happy in the city that you're in.
It's a super affordable city. I live right on the canal downtown, which is fantastic.
It's just full of life.
Restaurant scene, there's everything exists here.
Biking on the Monon Trail.
Amazing breweries that win, gold medals for their IPAs.
Just going to the sporting events around town. I mean, we've got the Colts, we've got a baseball team, we've got a hockey team, we got basketball with the Pacers.
Convenience is also very important to me. I have a 3-minute commute in the morning, and all of the hospitals are within a mile of each other.
Indianapolis really has everything to offer here.
It just felt like nothing could compete with here. Just knowing that I would see really sick patients throughout all the major hospitals. I think that's what I cared about.
I think it's really about the spirit of just getting in there and putting in your all for your patients as a team member, and that's the kind of cohort that I work with.
They really push us to explore more than just the medicine. Who are these patients? They're human beings, and we have the privilege to take care of them.
Even though we're a large program, they are very cognizant of how challenging it can be to transition into a residency where you're rotating through multiple hospitals.
I think that's something that we actually do really well here, is focus on the individual, despite the fact that, we do have 14 residents a year.
Our hospitals are big enough to accommodate this number of learners. I figured I would have like a small friend group within the big program, but turns out 56 residents is not too many friends.
You end up coming to a really supportive environment that it felt like home away from home.
Camaraderie here was definitely very strong. I have some co-residents that definitely will be lifelong friends.
That's something that I never really appreciate until much later on, is how great people get along together, because these are people that you're going to spend 4 years together.
We just want people who are wanting to work hard and become the best doctor they can be, but also have fun at the same time and develop good relationships with your co-residents and your faculty members. And
faculty is great about just giving what you need. They're there to teach you, they're there to be hands-on.
We have a pretty wide alumni network, so even during my interview trail, I would go to other programs. They were program directors who were alumni of Indiana University, which was really cool.
There's probably someone who's done it before you and can totally give you guidance in terms of how do you prepare yourself for that pathway.
A lot of the program leadership would also help me accomplish the goals I was hoping to accomplish. And I really have felt that my whole time here, been supported in really everything that I've wanted to do.
We really want them to become the best doctors possible. We really want them to be well prepared for whatever their future career goals are, and we feel like we have the resources to do that.
When people find out, oh, you're a Med-Peds resident, they're very excited about that. They're like, oh, this is great.
I knew that coming in as a medical student, that Med-Peds residents were always highly touted.
That feeling like, oh wow, we're really valued here, and our knowledge is valued here, and that just really, as a Med-Peds resident, makes you feel like you're in the right place.